So hello and welcome to our webinar today. Today's webinar will be on home energy upgrades as a public health intervention, and it will focus on findings from the Victorian Healthy Homes Program. I'll begin with introducing myself. My name is Evangeline Arithwala, and I'm the Alumni Engagement Officer with the CSE alumni team. Today I'm joined by my colleague Kirsty Scott. We will be hosting the webinar on behalf of the CSE, and we are pleased to welcome our speaker today, Toby Cumming. Hello and welcome, Toby. Hi. So to give a brief introduction about Toby, Toby is the team leader for research at Sustainability Victoria. After completing a Bachelor of Behavioral Science at the La Trobe University in Melbourne, he was awarded a Commonwealth Scholarship to undertake a PhD at the Cambridge University. After returning home, Toby worked for around 12 years as a research fellow at the Florey Institute, focusing on stroke and dementia. In 2019, wanting to make a greater contribution to the fight against climate change, Toby moved to Sustainability Victoria to work on the Victorian Healthy Homes Program. I'm pleased to inform that Toby is a 2001 Commonwealth Scholar from Australia. He completed his PhD in neuropsychology at the University of Cambridge. On behalf of the CSE, welcome Toby, and I now hand over to you for your presentation.
Thanks very much, Eva. I'm here to talk to you about work that we're currently doing. It still hasn't finished, the Victorian Healthy Homes Program, but it almost has. We'll be tying things up in the next few months. So I'm here to talk to you about what I think is a pretty innovative and exciting research project. But let me start at the start. So Commonwealth Scholarship was a big part of my life. This is a picture of Istanbul because when I left Melbourne to go travelling through Nepal and India and Eastern Europe, I still didn't know whether I had a scholarship. I was on the reserve list for the Commonwealth Scholarship. And so I was preparing to set out for England anyway, regardless of whether I ended up getting one or not. But I got an email when I was in Istanbul saying, yes, you've got a scholarship, you need to get us a medical. So I went to the American hospital in Istanbul and got medical approval and sent that off to Cambridge, and got to England and started my PhD. So this is where I ended up, in Cambridge at Gonville and Keys College, and had just a wonderful 3 years there. My research was in, as Ava mentioned, in neuropsychology. So here's a picture of the Cognition and Brain Sciences unit in Cambridge. And that's a massive mulberry tree, and we played croquet on that lawn at lunchtime. It's very idyllic English experience, and a great place to be a PhD student. Really cutting edge brain research happening there. I worked on quite a rare form of dementia for my PhD. And when I got back to Melbourne, I worked in stroke and dementia research for about 12 years. So continuing on the work I'd done under my Commonwealth Scholarship. But that's actually not what I'm here to talk to you about today. As Ava mentioned, in 2019, I just felt like we had an urgent need to do more about climate change. So I shifted field completely, and I'm still doing research, but now for Sustainability Victoria here in Melbourne. And before I launch into my talk, I just want to acknowledge the traditional owners of the land that I'm coming to you from, which is the Bunurong people here in Melbourne. So this will be the topic, improving house, improving health. And one of the things that people don't often think about is where you live is really important to your health. And when we upgrade houses from sometimes the pretty poor conditions that they're currently in, we've got a chance to actually reduce mortality. That sounds extreme, but it's true. We know that death rates in winter are higher than in the rest of the year. And we've known this since like the 1850s. Very early epidemiologists in the UK saw that in the numbers, that people were dying in higher rates in winter. So making better, warmer houses does save lives. And it increases people's quality of life too. It reduces poverty because they have to pay less in energy bills, which is a huge issue for a lot of low-income households, the percentage of their income they have to spend on energy. And it helps mitigate climate change because the less fossil fuels we burn to help heat our homes, the fewer emissions we create. So I've laid out a few of the SDGs down here, and I think improving housing is really important because it hits such a range of them. So it does create good health and well-being. We focus on affordable and clean energy. Creating the workforce to do these retrofits, these housing upgrades, creates economic growth. There's jobs there. We focus on vulnerable communities and low-income households, so it does reduce inequalities. These people don't necessarily have the money in their own pocket to pay for these upgrades or solar panels on their roof. And it's about sustainable cities and climate action. So before we launch in, I just want to, it's a little bit counterintuitive, but I'm going to be talking a lot about cold temperature and staying warm in winter. I know we're here for COP26, we're here for climate change and the world's getting warmer. But one of the focuses of this project is being too cold in winter is bad for your health. We currently burn a lot of fossil fuels to keep our homes warm. And if we can find ways to reduce that reliance on fossil fuels while still keeping our homes warm, then we're going to go a large way. I mean, residential energy use for heating spaces and heating water is a very big emissions contributor. So if we can reduce that, it's going to help in the battle against climate change. I'm going to start back over in Europe. So this was a study from '97 that I think is a fascinating study, looking at, as I was saying, this bump in mortality over cold times of the year, the increased mortality in winter. And this group looked at what that's associated with. And as you might expect, it's associated with lower temperatures indoor in your living room. If you've got lower living room temperatures, you're more likely to have higher rates of mortality. But the really counterintuitive finding was it's associated with higher average winter temperatures outside. So if you live in a place in Europe where it's generally warmer in winter, you also have higher cold-related mortality. And so this seems a bit strange. Let me provide you with an example. Let's look at Mediterranean Athens compared to the south of Finland. You can see from this table here that for every 1 degree below 18 degrees, there's a 2.2% increase in mortality in Athens, but only a 0.3% increase in Finland. So you might expect the Mediterranean to be more temperate and less of a problem for cold-related mortality, but the opposite's true. And this is a range of reasons. One certainly being the quality of the housing stock. So when you see it's 7 degrees outside, the houses in Finland are 2.5 degrees warmer than they are in Athens. But it's also about behaviour. When it's 7 degrees outside, about 3/4 of Finns are getting around in warm beanies, where hardly anyone in Athens is. So this relates to our experience in the rest of the world. Here's another example from a very different climate, Taiwan, not too far from the equator, subtropical. But you can see here with mortality on the vertical axes and all-cause mortality, cardiovascular and respiratory as the 3 boxes, pretty similar relationship with colder temperatures on the left and warmer temperatures on the right. You can see across all of them higher mortality rates at colder temperatures, even in somewhere like Taiwan. Now, moving colder in the southern hemisphere, some of the best research in this area has happened in New Zealand. So it's a very impressive research group run by Philippa Howden-Chapman that devised a couple of really nice, simple trials. The first one was reported in 2007 in the BMJ, and they just put insulation in ceilings in houses, and it was a randomised trial. Some were insulated, some not, focusing on low-income households. And sure enough, they found that the energy use dropped. So insulated houses were only using 80% of the energy of uninsulated houses. But the really impressive thing were the health outcomes that they found as a result of it. So let's look at their temperatures. They're pretty shockingly low. You can see here the temperature, which was the average winter bedroom temperature, 13.5 degrees in the intervention group before the intervention. And it boosted a little bit after the intervention, but only about half a degree to 14.2. Now, keep in mind that the WHO suggests 18 degrees is a minimum level for health, to protect your health. So 14 degrees is really much too cold. The striking thing, even though it only went up half a degree after the intervention, look at people's experience, the self-reported experience of the house. When asked whether the house was cold most of the time or always, before the intervention, about 400 out of the 550 said, yes, it's too cold most of the time. After the intervention, less than 100 said it was too cold most of the time. So that half a degree really can make a difference to people's experience. And when they looked at health outcomes, they found a really impressive array of particularly respiratory health, so less wheezing, not as many GP visits. The children went to school more, the adults went to work more. And in the table here, you can see before and after intervention, roll physical, and this is on a scale where the best score is 100, went from 53 to 70. But the other noticeable thing was it's not just physical benefits. You get mental health benefits too when you have a warmer, more comfortable house. So social functioning went up and emotional functioning went up. And I think this speaks to connectedness. When your house is a warm place to be, you will invite your friends and family around to be part of your life and spend time at your house, whereas maybe you wouldn't if you were self-conscious about it being too cold. The follow-up from the same research group came out the following year, and this time the focus was on kids with asthma. And so this time it was heating. It wasn't insulation, just efficient heating. So, but again, a very cheap intervention. It might cost $1,000 or $1,500. Let's say 500 to 750 pounds for an efficient heater in some of these houses, and that was the scale of the intervention. It's not an expensive thing. And again, they found an array of positive health outcomes that you can see here. This one did even better for increasing the temperature. So if you look at the living room, the intervention group got up to about 17 degrees average temperature, which was a good degree warmer than the control houses. And so the important thing about this research is it doesn't just sit there in a journal without anyone looking at it. It's had a major influence on policy. Straight after these trials came out, the Warm Up New Zealand Heat Smart program was initiated. And so that ran for 5 years, focusing on older homes, so homes that were built before 2000. And it wasn't heaps of money. So just a 33% subsidy on your insulation, up to about 1,300 New Zealand, must be £600 or £700. And if you were low income, you'd get slightly more subsidy for insulation, and you could also get a subsidy towards an efficient heater. But it's not rocket science. It's a couple of things to make your house warmer and more comfortable and reduce the energy you have to use to heat it. And here was the outcome. They ended up investing about 350 million New Zealand dollars in this 5 years and retrofitting about 250,000 homes. When they did the cost benefit, they showed that the net benefits of the program were 1.3 billion. And of every dollar spent retrofitting homes, they saved $4. So a pretty impressive cost benefit ratio. And what was really amazing to them was they did reduce energy costs a little bit, and that fed into the benefits, but 99% of the benefits were due to health gains. So if you're just thinking about an energy efficiency retrofit of homes in terms of how much you're going to save on your energy bills, you're potentially missing a huge part of the puzzle. And this is really what inspired us to start the Healthy Homes Program in Australia. Not just this program, but it also affected government regulations and mandatory standards for rental houses. Rental houses are a bit tricky. There's a split incentive. So if you say do energy efficiency upgrades or put solar panels on a rental house, the landlord gets the benefit from the increase in thermal shell, increase in value to the house, and the tenant gets the benefit of paying lower bills. And so it's a bit hard to work out a program where you balance that split incentive. One way to do it is just to increase the standards across the board. And this is what New Zealand did, to say, if you're renting this house, it must meet certain health and comfort standards, and you can see them here. Now, as I mentioned, the WHO came out in 2018 on the basis of quite an extensive systematic review to ask the question, is living below 18 degrees bad for your health, basically? Is it worse than living at 18 or above? And their assessment of the research was that the evidence level was strong. Yes, it is. And they proposed 18 degrees as in temperate or colder climates as a safe and well-balanced indoor temperature to protect health. So that's the benchmark we're aiming for, really. Now, I know a lot of people, particularly in the UK, see Australia as some sort of tropical paradise with just beaches and cocktails lying on the sand. Some of it's like that, but not necessarily where I live in Victoria. Here's a bit more information about Victoria for those of you who aren't familiar. So we're right at the bottom. I've got about 6 million people, and that we live across about 2.5 million households. And the important thing to understand about those households is that we didn't have any regulations in terms of houses, that new build houses. Energy efficiency regulations didn't exist until 1991. And more than half of our houses were built before 1991. So we've got this big housing stock, 1.3 million houses, that were built before any standards existed. And you can see here the NATA's rating is a rating scheme. And our current minimum standard, if you build a house today, it has to be at least 6 stars. But of those pre-1991 houses, the average rating is 1.5 stars, 1.6 stars. So we've got a long way to go to bring these houses up to scratch. They tend to have inefficient appliances and lighting. The average energy bill is getting up to $3,000. So this is sort of £1,500. And Victoria is not a warm place. So if you look at the year across the 12 months and you didn't heat houses at all, 2/3 of the time, those houses would be under 18 degrees. So heating's a big thing that we have to do. Sadly, Victoria's power sources are historically pretty dirty. We have the Latrobe Valley just east of Melbourne that has a huge amount of brown coal. Burning brown coal is even worse than burning black coal because there's quite a lot of moisture content in brown coal, so it's quite inefficient. So that's what's powered Victoria's electricity system for many decades now, the brown coal power stations of the Latrobe Valley. And for heating our homes, we're very reliant on gas, much more than other states in Australia. We've got Bass Strait between Victoria and Tasmania there that has plentiful gas supplies. So as a historical legacy of that, we plugged into the cheap available gas in Bass Strait, and the vast majority of Victorian houses use gas from the reticulated gas system piped straight into your house to heat space, to use for space heating over winter in Victoria. So that gives you a sense of the challenge of increasing our housing stock and trying to wean ourselves off burning of fossil fuels. So let me tell you a bit more specifically about the Healthy Homes Program. It's a first in Australia randomised control trial that aims to measure and monetise the health benefits of improved warmth and energy efficiency in low-income householders with a complex health or social care need. So essentially, we are giving householders an upgrade, but we've also designed it as a randomised control trial to collect data. Now, the intervention we're giving is this free upgrade, which can be up to about $3,500, which £1,500 to £2,000, with a focus on thermal comfort and energy efficiency during winter. All our upgrades were really targeted at winter warmth. So actually, we don't include solar panels because that doesn't contribute to the thermal shell of the house. And the trial was designed so that all households could receive the upgrade. We didn't want to withhold the upgrade from a control group because we wanted to deliver the upgrade to everyone. But we designed it so the intervention group, those households randomised to the intervention group, had their upgrade before winter, and the control group had to wait till after winter to get their upgrade. And then the focus was measuring the difference between the two groups in energy use, in health, in temperature in their house during the winter period. So that was the basic idea. And here's where we are in Victoria. So 800 households in Western Melbourne, which is in the suburbs, essentially, Melbourne being a pretty big city. And further north, up near the Murray River there, those red local government areas around Shepparton in a regional area called the Goulburn Valley. We had 200 households there too. And here's what the upgrade could consist of. We could draft proof, so essentially sealing up gaps, put insulation in the ceiling or under the floor. We used high efficiency heating and cooling appliances like the split system, electric sort of heat pump driven split system that you see here that gives you heating in winter but also cooling in summer. Although we really weren't focused on the summer period, it was all about winter warmth for us. And window covering. So obviously you lose a lot of heat through glazing, and so drapes and curtains was another one of the upgrades we were installing. And it was an intervention based on individual houses. It wasn't a one size fits all. We would assess each house and aim to make it warmer, drier, more efficient, better air quality and ventilation inside, and a reduction in energy bills. So here's the one slide graphic of the trial design. Essentially, a household expressed an interest and we confirmed whether they were eligible, which was generally around being low income and having a health care need. Then we did the first home visit and we got their consent. We asked them some questions in a number of surveys. Now, the residential efficiency scorecard is essentially mapping out the efficiency, the energy efficiency of a house, and it's quite detailed information. So it can take a couple of hours and looks at appliances, windows, general floor area, etc., etc. One, to understand the data of houses we're working with, but two, one of the things that the scorecard does is identify potential upgrades, things that were missing or things that weren't so good in that house that we could feed into our intervention. So that after the scorecard, the houses got randomised to intervention or control. Intervention houses upgraded before winter, controls were just waiting. And then everyone after winter got the second home visit, where those surveys from the first home visit were repeated. So we asked much the same questions again. And then after that was done, the control houses got their upgrade. So that's essentially the trial design. And here are the outcomes we're interested in. So primary outcome was whether we could boost the temperature by doing these simple, straightforward, not very expensive interventions. Is the intervention group warmer in winter? Secondary outcomes at the household level included things like humidity, and temperature and humidity were recorded by a little monitor that sat on the living room wall and measured those factors, temperature and humidity, every half hour for the entire winter period. So that's a very deep data set that we have there on temperature and humidity. We also are looking at changing the amount of mold and mildew and damp, because we know they are big problems for respiratory disease and can exacerbate those symptoms. Energy use by the household obviously is a big one. We want to show reduced energy use. Now, at the individual level, our secondary outcomes were mostly around health and quality of life, including respiratory symptoms, how much healthcare people were using, how much they're showing up to hospital, GP visits, absenteeism from school and work. And underlying all this was a health economic evaluation. So we are doing a pretty comprehensive cost benefit analysis of the intervention. Just to dig into the data a little deeper for those who, like me, are pretty nerdy about data, here's a more detailed breakdown of the energy data and the health data we're collecting. And so we are, as I said, we're surveying participants before and after winter, but it's backed up by a whole lot of objective data that we're getting from that data logger that's on the wall, but also the external temperature and humidity data from the Bureau of Meteorology in the area of the houses. We're getting energy use from meter readings and self-report surveys and from the energy providers to look at that a number of different ways. And we're getting the scorecard assessments for energy. And then the health data is a whole range of linked data through government agencies here in Victoria and federally in Australia. So Medicare, pharmaceutical benefits scheme, how many medications these participants are using. Quality of life surveys are very important for the cost benefit analysis and understanding generally people's quality of life. And then a whole lot of hospital data sets as well. So mostly based off the New Zealand results, where we thought it was important to really dig down into those health outcomes. Here's an example of the fine grained detail in our temperature data. So this is a winter period from 2018. You can see on the horizontal axis of July to October, with the black squiggly line in the middle, the mean internal temperature. And you can see our temperatures already are a little bit warmer than the New Zealand ones. So that mean temperature, this is only our first 100 houses in 2018. It's hovering around 18 degrees. And you can see each of those blue lines is an individual house looking at their temperature profile across the whole winter period. And it's those ones below the dark black line below the mean that we'd be pretty concerned about. And then in red, underlying it all, is the outside temperature. Here's a little breakdown of the type of households that are involved. So this was our first 2 study years across 309 households. You can see household income less than $26,000 a year is more than half of our houses, so they are low income, but actually quite a few of them own their house. About 3/4 of them own their house but don't, so sort of asset rich but income poor, if you like. More than 60% say their house is colder than they would have liked, and we over sampled asthma, cardiovascular disease, and those with poor health, which was in our eligibility criteria, but that's just showing that that's coming through. And it's an old population. So half of our participants were 75 or over, about 3/4 were over 65. So a lot of retired people that's spending a lot of time at home. I know even non-retired people have been spending a lot of time at home this last year or two and discovering just how thermally inefficient their homes are. But our cohort was quite elderly. Now this is, and as I said, our results aren't through, and so I can't give you the big reveal of intervention versus control group, but this is a little taste of some of the data that has come through to do with the residential efficiency scorecard. So that's the RES at the top here. And here the graph's looking at winter energy savings for every 1-star increase in that scorecard. So the scorecard is a star rating from 1 to 10, with 10 being the best and 1 being the worst. And here you can see total kilowatt hours on the vertical axis, as in energy saved during winter. And that's electricity in the dark green bars, and gas savings in the light green. So if we just take the left-hand set first, the full cohort of about 300 houses for these first 2 years, you can see pretty substantial savings in electricity and gas just by bumping the RES scorecard up 1-star rating. And the take-home message from the other 2 sections, the 1 to 5 stars and the 6 to 10 stars, that's just a breakdown of the full cohort. You save a lot more in electricity and gas by taking a 2-star house and making it 3-star than you do taking a 6-star house and making it 7-star, for example. So this is really telling us that we've got to be going for the worst houses first if we want the best bang for buck. So how about temperature? For when we make the efficiency scorecard up by 1-star rating in a house, here's how much you reduce time spent under 18 degrees. You can see in the full cohort there, it's more than 50 minutes a day just by taking a house from, say, 4-star to 5-star. And again, if you take a poor, inefficient house, you get more than an hour back saved under 18 degrees as compared to the slightly more efficient houses, the 6 to 10-star, although there's still definitely advantage, almost half an hour that they're being reduced under 18 degrees. You're eliminating cold for much longer in these houses just by making a house 1-star improvement on the scorecard. So the big question though is when we do this intervention and we make houses warmer, does it improve people's health? Does it improve people's quality of life? And the whole idea for us is to use that evidence to say to government, we're saving you a huge amount in your health budget. We need to roll out a much more substantial retrofit energy efficiency upgrade program to some of the 1.3 million homes that are still substandard. It's great for Healthy Homes to be upgrading 1,000 homes, but really that's a drop in the ocean given our huge housing stock that's old and inefficient. So that's our main aim. We want to provide this health evidence, provide really solid cost benefit data, and we're hoping that when the results come in February next year, we'll be able to make those arguments and really scale up our retrofit program, our improving these homes alongside electrification and getting off our reliance on gas that I mentioned is one of Victoria's big challenges. So thanks for inviting me to speak. Thanks for your attention, and I look forward to any questions that you have.
Thank you so much, Toby, for your brilliant presentation and a very different topic to be part of our CSE Climate Action webinar series. So thank you so much for shedding light on your work and also your expertise around this area. I would now like to invite attendees to send in your questions via the chat box. We'll now open the Q&A session. Equally, if you are working in a similar work area or are conducting research in something similar, please do feel free to share your thoughts and views in the chat box, and perhaps we could also unmute and have an open discussion during the Q&A session. We do have a couple of questions that have come in advance to the webinar. So if you're ready, I would like to bring them up and put them across to you.
Sure.
Great. So the first question is around biogas and LPG. So I'm not sure if you know the full form of LPG, but the question is around between biogas and LPG, which is cleaner to use for domestic purpose?
Wow, that's an interesting question. The answer is I'm not sure. The focus, the real problem we have is that gas is still a fossil fuel, and actually emissions from gas, I think, are often understated. But we know now that when you when you look at all the emissions created by producing gas, transporting gas, burning gas, even 10 or 15 years ago, we thought gas might be a good sort of bridging transition fuel that was less harmful than the electricity that we got from burning coal. And that was probably true 10 or 15 years ago. It probably was better to heat your house with gas in Victoria than it was to use dirty brown coal-fired electricity to heat your house. But we're at a point now where we just need to totally eliminate gas, I think. Maybe in heavy industry that's going to be hard, and there will still be some niche areas that will need to use it. But certainly in areas like residential space heating and hot water heating, we really need to be moving to electrification and away from gas. And that's going to be quite disruptive. Certainly in Victoria, it's going to be very different to what we have today. And it's going to increase our need for electricity. So not only are we going to need to shut down these coal-fired power stations that are burning dirty brown coal, we're not only going to need to replace that with wind and solar, we're going to actually need 50% again to cover for all the gas that we're now, used to use for heating our spaces and heating our hot water that we need to transfer across to electricity. So basically I don't see gas as being part of the answer for residential purposes. I think if you think about your house at the moment, we're really using three fuels. Certainly in Victoria, the standard house uses three fuels. You use petrol for your car, you use gas to heat your spaces and heat your hot water, and you use electricity for everything else. You generally use gas for cooking here too. And I think the opportunity and the massive efficiency to be gained is switching from three fuels to one, so that you don't have petrol in your car, you have electricity. You don't heat your water and spaces with gas, you do it with heat pumps via electricity. And that once we do go all electric, probably with quite a substantial solar system on your roof, it will just absolutely transform people's health and comfort, people's cost of living, and you will have your car in the driveway that will be your battery, essentially, that you can feed into and out of the grid. So I absolutely think that's where the future is, not with gas.
No, I think that's a really great response, Toby. Thank you so much for responding to that question. The next question is around working with stakeholders. In your experience of being part of this project, how or have policymakers and those involved in this intervention worked with energy companies to ensure that post-fitting energy efficient systems for low-income households are made more affordable to these families to heat up their homes, and maintain the 18 degrees minimum temperature?
That's a really great question, and we have a lot of stakeholders. This is a randomised controlled trial research project, but Sustainability Victoria is a government agency, so it's been really interesting for me to run a research project from government. We have a delivery partner that has been responsible for the upgrades and actually doing the works in houses, and they're very experienced with vulnerable populations. So they've been great at communicating and staying in touch with these households and informing them about how to use their appliances or informing them about the worth of their upgrades. And then on the research side, we have a research partner. We have a university stakeholder that is collecting the data and analysing the results. So it's a complex project with a lot of relationships and a lot of moving parts between the stakeholders. But on the part of the question around how can we get low-income householders to essentially be able to have a more efficient house and to be able to save money, there's been some amazing case studies that we've done. So one woman that springs to mind had an all-electric house with old electric heat banks. So people probably don't even know this technology, but they're massive and they're hugely inefficient. And she had 2 of them, and she could never get her house warm enough, and she was still paying a huge amount of money from her pension, which is not big, to heat her house. So we essentially took those 2 heat banks out and just put one split system in, a much more efficient split system. And she just sent me her bill because she was so excited about it. She just had her first winter, this winter just gone, which is her first winter post upgrade. She'd gone from 42 kilowatt hours last winter to 10 kilowatt hours this winter. So at a 25% essentially was of the energy she used to be using, and her house was much warmer than it used to be. So that just transforms her life. She probably saved $400 or $500 over the winter period compared to this time last year, and that's just in 1 year. So that is a huge important part of the program. People that live in these houses, it's not their fault that the house is built to no standards. They just happen to be living in it, and they just happen to be bearing the brunt of the massive cost of heating it. I just don't think that's right. We need to be thinking about equity here and helping out those vulnerable populations, because it's society's responsibility. We created these poor houses in the first place, and we need to do something about it.
Oh wow, that's a really huge difference on a particular household budget. The example that you just mentioned. Just following to that, as a follow-up question, are there any plans to pilot? I mean, are there any plans to take this pilot project further in Australia, or do you have any plans for work with other countries, or like the neighboring countries? Do you have any plans to implement this further?
There are some groups I'm part of around Australia as a whole, nationally, that are looking to try and address this problem of old houses that need to be retrofitted. Victoria is a particular problem because we're one of the colder areas, but there's other parts of Australia that have the same problem, and a lot of my colleagues are waiting for our results, waiting with bated breath to hopefully be able to point to our data and say, here's what we need to do, because look at how much money we're going to save, and look at the health gains we're going to get. So that's the dream, really, that we can use our data as a baseline to then go and scale up and come up with some sort of revolving finance model. So you don't just need lots of bitsy projects doing a few upgrades here and a few upgrades there, but you can say to a government, we want to do 100,000, 500,000 home upgrades, and for each one we do, you can trust us that you'll be saving this much, because we know we've modelled the health benefits based on these great healthy homes results, and that way we can just keep the sustainable finance model going. It's not a small project gets funded and then it's finished and you look around for more funding. It's just a rolling upgrade program that has continuous funding, if you like.
Thank you so much for responding to that question. I do have a last question on my list, but before that, I would like to ask attendees once again, if you have any questions, or you would like to share your thoughts, please do that via the chat box. Well, the last question for you is, what are your thoughts on this? So as part of the system and its impact on energy consumption, what percentage of energy is renewable? I'm not sure if you would have the answer to that, but approximately.
In Victoria?
Yes.
I don't have the exact number to hand. The answer is it's still not huge, but it's growing. And Victoria actually has been doing some great things here in Australia in emissions reduction. Our trajectory of emissions reduction over the last 10 years is a pretty impressive decline. And a lot of that is due to more solar and wind coming online. And actually, one of our big brown coal burning power stations called Hazelwood was decommissioned back in 2017 or 2018, I think. So that gave us a big jump in renewable percentage. But off the top of my head, it's not greater than 20 or 25% still. We've still got a long way to go in terms of our renewables mix in the grid. We're still pretty reliant on burning coal here and burning gas, as I said. And there's no reason why Australia should be. We've got a phenomenal solar and wind resources, and we should just be doing everything we can to tap into them. We're world leaders in rooftop solar, which is great, but there's lots more to do in those big scale solar projects and big scale wind projects to make sure we get lots more renewables coming online.
Definitely. And I do appreciate your response to this question. It can be slightly tricky, but you've done best to respond to this question. And yeah, as you said, a long way to go, a lot to learn, but we are getting there. With this, I come to an end of the Q&A session. Thank you so much for presenting your topic and being part of the CSE's Climate Action webinar series. I would also like to thank our attendees for attending this live session and being part of the audience and for engaging with us in this webinar. Any final thoughts, Toby, before we end the session?
Oh, thanks for the opportunity to speak to you. I think COP26 is a big moment and a really important moment in world history, I think, and we're all hoping for a really great outcome, because this is absolutely the number one issue that we need to solve. And I'd also just like to thank the Commonwealth Scholarship Commission. As I mentioned earlier, winning a Commonwealth Scholarship has really, I think, changed the trajectory of my life. It was a fantastic opportunity just to study and to do a PhD in the UK for 3 years. And what I learned there, I've applied in all my roles since. And so, yeah, thanks to the CSC. It feels like ancient history now, 20 years ago for me, but I'm still very appreciative.